And thank you for joining this afternoon. My name is Mandy Cooper, and I am a sophomore nursing student with a certificate in global health at the University of Pittsburgh, and I'm also a member of the university's Honors College. Through the School of Nursing, I'm involved in the undergraduate research mentorship program, where I have been introduced to healthcare-related research for the past 2 years. Through the undergraduate research mentorship program, I was paired with Dr. Haley Germack, an assistant professor at the School of Nursing in the Acute and Tertiary Care Department. Dr. Germack and I have worked together for the past 2 years on various projects, including medication changes during pregnancy and behavioral health issues and different factors in the community that can affect access to care. And we are continuing to work together this summer. So my research mainly focuses on hearing loss, specifically among young populations. So roughly 38.2 million Americans suffer from hearing loss, and it is a widely understudied area of healthcare. There is specifically a research gap in the literature for effective care solutions for patients with hearing loss under the age of 26. Most of the existing literature focuses on older populations because hearing loss often occurs as a natural process of aging. Furthermore, trends show that patients are left dissatisfied with the care given, stemming from a lack of understanding by the healthcare providers, ineffective treatment, and inability to access adequate care, among other factors. So I'm going to go through a quick case study real quick. So we're going to focus on patient X. After failing several hearing tests at school, patient X, who was age 15, sought out help from her primary care provider for almost 3 years. Her pediatrician kept informing her that there was no problem with her hearing even after running some hearing tests. Patient X was experiencing episodes of extreme dizziness with nausea while her hearing loss worsened into high school. Finally, patient X made an appointment with an audiologist and was diagnosed with mild sensorineural hearing loss in her left ear after undergoing extensive hearing testing. She also had multiple CT and MRI scans done, which ended up in a diagnosis of a mild Chiari malformation, which is when some brain tissue extends into the spinal canal due to an abnormally small skull or a slight deformation in the back of the skull. Some symptoms from the Chiari malformation can include headaches, dizziness, poor coordination and balance, and ringing in the ears. So this was not connected to her hearing loss, but it was a separate diagnosis. Patient X also underwent vestibular testing, which came back with normal results. At the time, patient X was just fitted for a hearing aid and was told to schedule annual checkups. Over the course of the next few years, patient X's hearing ability decreased significantly into the severe category. Her hearing aid's amplification was set to the highest level, and she still goes to annual checkups. Now back to my research process. My research question was, among patients under 26 years old, what trends in utilization of care related to hearing loss, and how do socioeconomic factors influence access to care, and how do clinicians incorporate patient preferences? Hearing loss can negatively impact the academic, social, and emotional development of young populations compared to their full hearing counterparts. Additionally, deaf children who lack accessible language, like sign language, are likely to face cognitive delays and face childhood isolation. Children with severe enough hearing loss can have a hard time learning to communicate with non-deaf peers, especially if they are denied education in that language area. So there are 2 main categories for types of hearing loss. Conductive hearing loss occurs when there's a problem with the ear itself and the inner ear, due to mainly physical things such as trauma, deformity, an ear infection, tumors, or even something as simple as earwax buildup. On the other hand, sensorineural hearing loss is usually permanent hearing loss, dealing with the nerve pathways that transmit what you hear to your brain for interpretation so you can understand the sounds you're hearing. And it can typically be caused by trauma, aging, medications, loud noises, and genetic factors. Conductive hearing loss can be improved by surgery, amplification devices such as the hearing aid and microphone device that are pictured on this slide. On the left of that top picture is a hearing aid, where that little ball part would go inside your ear and the wire would loop around the back. And then right next to it is an amplification device where you would wear the earbuds and then have people talk into that microphone on top of the little silver box. And then it can also be fixed by medications or antibiotics if there is like an ear infection or something like that. And then sensory neural hearing loss can sometimes be improved by corticosteroids and surgery. However, usually patients are prescribed hearing aids, and it can amplify the sound but will not help too much with the interpretation of those sounds. Cochlear implants are indicated in children who have bilateral hearing loss that is considered severe, even after trying to use hearing aids for a period of time. So it's kind of hard to be ordered a cochlear implant because it's a super invasive surgery where they implant an electrode to stimulate the cochlear nerve, and they're very expensive and typically not covered by insurance. Both hearing aids and cochlear implants can amplify sound so that hopefully the patient can better keep up in normal conversation. However, like I already said, it will not totally help the interpretation of those sounds. There can be many factors that contribute to denying a patient care. This is especially true among children who are completely dependent upon their parents for all healthcare needs. Hearing loss services can be very costly, and maintenance to keep up with treatments such as hearing aids is expensive over time. Hearing aid batteries and wax guards must be paid for monthly out of pocket. Additionally, most hearing aids only last about 2 to 3 years and can cost upwards of $6,000 to replace each time. These costs can obviously add up over time, and most insurances do not cover it after patients are older than 21. Also, geographic location can be a barrier to accessing treatment because hearing loss is often not considered an emergency or urgent issue that requires treatment. So if that treatment is not easily accessible, like in a big city, or if you live in a rural area, then people often just do not seek treatment. And this is especially true if parents do not deem like their children have severe enough hearing loss to get that treatment, if it's not easily accessible. So the objective of this narrative review of the literature aims to look at a wide scope of studies on patient hearing loss in general. The review concentrates on youth affected by hearing loss, the care available and received by this population, patient preferences for available technology and treatment, and barriers to care that this population faces. So narrative review is a general approach to identify studies that describe a problem of interest and establish a context for an area of research. It is a good introduction to an area of interest so that you can delve deeper into that specific topic, and it provides a nice foundation for your topic. To perform the literature search, I utilized the PubMed database with search terms hearing loss, access to care, and patient preferences. This search yielded 178 articles. A majority of the literature focuses on elderly populations, likely because hearing loss is a natural process of aging and therefore common among this age group. Of the 178 total articles, only 39 focused on my target population. This is problematic because younger populations are more likely to suffer greater losses over a lifetime with hearing loss. Furthermore, clinicians dictate treatment plans with little input from their patients and often prescribe hearing aids as the only option, even if patients report that they lack in terms of improving quality of life. Many patients prescribed hearing aids report that though they amplify sound, they do not fully treat their problem. In conclusion, more research must be conducted on patient preferences for treatment of all types of hearing loss. Research and funding must address the lack of effective treatments to better young adult patients' quality of life. Many patients, including patient X, are left unsatisfied with the treatment they receive. So patient X is actually me. I do wear a hearing aid in my left ear to correct the severe sensory neural hearing loss that I have. And while the hearing aid does amplify everything I hear, I'm constantly asking people to repeat themselves or making them sit on my right side, or just smiling and nodding along with the conversation that I can't hear. So, as you can tell, I do have a personal connection with this research, and I'm extremely passionate about pursuing even more research in this area throughout my nursing career. I was recently selected for a Brackenridge Research Fellowship through the University of Pittsburgh's Honors College, and will continue this project over the summer. The Brackenridge Research Fellowship is an interdisciplinary research program that will help me develop my research and better understand how focused research can expand into other areas of interest. My goals for the summer include looking at opt-in data to examine demographic variables, including sex, age, region of residence, and whether or not patients live in a rural or urban area, And I also hope to look at socioeconomic variables, which could be household income and community education level, among other things. I will conduct semi-structured interviews with pediatric patients with hearing loss and their families, and patients and their families will be recruited from the Audiology Services Department of UPMC Children's Hospital of Pittsburgh, which is where I receive my care and go for my checkups. An estimated 5 to 10 interviews lasting about 30 minutes will be conducted using a semi-structured interview guide. Then interviews will be transcribed and analyzed using directed content analysis. I'm extremely eager to get started and to continue delving into this area of interest. So thank you for watching. Are there any questions or comments? Thank you.
Very well done.
Thank you. So yeah, we're hoping to get like 5 to 10 families to participate, but I think that'll mostly just depend on whoever's willing to sit down and call me for 30 minutes. It wasn't too hard collecting the data. I did start this review way back in like September, I think. So I had a few months to read through all the articles and then choose which ones were relevant for my topic. Okay, any other questions or comments? Oh. Yeah, that would be awesome if I could expand to a larger population. I think it'll be interesting to see what kind of results I get from this smaller group and then take it from there. Hopefully I can get some more people in my study. That would be awesome. Okay, thank you all for the questions and feedback.